Oh, so moving to the next lecture, which will be talking about the APGAR score. So let me say you actually gave birth to your baby. So you want to access the health of that baby. All right. You want to know, okay, is the baby fine and all of that. So there's a way that medical professionals will use to like access the baby. So I would like to actually like describe it. So the APGAR is like an how will I put it? The APGAR is a mnemonic. All right. A standing for appearance of the baby. How is the skin of the baby appearing? P standing for pulse. They are trying to check, all right, how is the heart of the baby beating? How is blood going around? Grimace is reflex irritability. You know, if you touch the baby, do they cry? All right, do they cough? Do they sneeze? I mean, the baby is just dumb. Do you understand? Activity, muscle tone, is it active or the baby is weak? Or is the baby very stiff? Do you understand? Then respiration, all right, is the baby breathing on fine? Now this APGAR is a mnemonic. APGAR is still a name of a person. So the person was Connie. He developed something that was linked to his name. All right. So the APGAR score is a quick and simple test that we are using because you want to access a newborn's health immediately after birth. Okay. It was developed by a doctor known as what? Dr. Virginia APGAR, and is typically performed at 1 minute to 5 minutes after delivery immediately. So as they just take the baby out, it's another function of the other medical professional, all right, or even the doctor that delivered, to ensure that this baby is all right. Now this could help you know a lot of things, whether this baby is in stress, so you have to now go into what, taking care of the baby, or this baby is fine. Okay, so here is what APGAR stands for, with each category scored from 0 to 2, like you are scoring the baby from 0 to 2. Let's break it down. Now it's the same thing that is here. Okay, it's the same thing that is here. So we'll just talk about what is here. Okay, so if you want to check the appearance of the skin of a baby, the score, remember, is what? 0, 1, 2. So now I want to talk about what will make you give a baby a score of 0, what will make you give a baby a score of 1, what will make you give a baby a score of 2. All right, so for the skin appearance, if it is blue or pale all over, a score of 0. Of course, what will make a skin blue? When the oxygen supply is not enough. All right, so oxygen supply is not enough, you have hypoxia, you have cyanosis. Okay, now if the baby's body is pink, then the lower extremities are blue. That means what? The rest of the body has blood supply, but the hands and legs are the ones that are having little blood supply. So give them a score of 1. All right, if the baby's body is completely pink, that's to tell you that what? Blood supply is all around. You give the baby a score of 2. All right, so that's it for what? Appearance, that's the skin color. Pulse, you are trying to check how the heart is beating. If it is absent, 0. That means the pulse, you usually feel it on the hand, right? Or you feel it on the leg or any place, right? There are several places for feeling pulse, but most commonly on the hand. So if you feel the pulse and it's below 100 beats per minute, you give him a score of 1, at least it's present. If you feel the pulse and it's normally above 100 beats per minute, you give him a score of 2. Then grimaces, you're trying to look at the reflexes. All right, so if you try to elicit some reflexes and the baby does not respond, or the baby is not stimulated, you give the baby a score of 0. All right, so if you try to elicit some reflex and the baby gives a weak cry, score of 1. If the baby cries, pull away, cough, sneeze, the baby is active, score of 2. Then activity, you are trying to see how, you know, is the baby strong, you know, so the muscle activity, you know, muscle tone, you are trying to see. So for the muscle tone, if limp, score of 0. Some flexions, that's like there's muscle tone in the limp, score of 0. If some flexion of the arms and legs, score of 1. If there's active motion everywhere, score of 2. Okay, respiration, if the baby is not breathing, score of 0. You are losing your baby. All right, then point 1, if the baby is breathing but is weak, is irregular, score of 1, at least is present. Okay, then score of 2, strong cry. So now look at this. After you are done with scoring the baby in all of these things, you now come and add, okay, skin appearance, I got which number? You add all of them. So now let's talk about what you do with the score. So interpreting the score, if you add, it's just like the baby wrote a test, right? So if the marks of the baby is between 7 to 10, all right, it's a normal baby, he's a brilliant baby, right? If it's 4 to 6, it's fairly low, you need some 1 or 2 medical assistance, all right, to take the baby up to that brilliant level. If it's 0 to 3, the baby is weak, you are losing your baby, all right? So important to know that the APGAR score isn't used to predict long-term health outcomes. It's just a quick snapshot of that moment, all right? So you can still be doing it later on and all of that. So that's just what the APGAR score simply means.